Welcome to the makeup edition of Dr. Twyman's Ask Me Anything. So I know this wasn't announced in my stories. That's okay. The archives will be here for those that submitted questions from Monday. I was doing some traveling, doing some recharging in Arizona out at the Canyon Ranch. Phenomenal facility. If you ever have the ability to get to there, it's well worth it. So posted a few of the pictures in my stories recently. Amazing place to kind of rebalance your autonomic nervous system. There's great workouts, great meditations, great food, great staff. So one of my favorite places to go is the Canyon Ranch out in Tucson. Yes, it was pretty warm, getting about 112 degrees in the middle of the day, but no significant humidity, so it's kind of like a sauna. So thank you for those joining. I'm going to go through the questions that were submitted on Monday. If there's any questions that you got in the interim, just drop them in the comments. I'll try to answer them as well. So I'll be on about half an hour or so, and we'll get started. So there was a question about how important are the oxidized LDL results? If you're in the right range, is there plaque buildup? So there's different variables that you can look at on the Boston Heart Labs or the Cleveland Heart Labs. One of them is oxidized LDL. That's kind of the older way to look at things. A more sensitive test is the oxidized phospholipid on ApoB test, which is only available with Boston Heart Lab. But if you're oxidizing your lipoproteins, you're essentially rusting them. Those damaged lipoproteins are then modified and are basically something that the immune system sees as foreign. And the immune system gets activated, starts attacking it, and causes this vascular inflammatory response in the intimal space. So having high oxidized LDL doesn't necessarily mean you have plaque. There's just more risk that the glycocalyx and the lining of the artery is going to get damaged and you could build up plaque. So I'm always monitoring it because it's a marker of your lifestyle. Is it really in check or not? Next question is an EP question or electrophysiology question. Somebody reports that they have high resting heart rate after having an AV nodal reentry tachycardia ablation. The heart rate used to be 55 to 65, and now they're 80 to 90, even with the beta blocker. This is not in my area of expertise, so it depends if something happened with the ablation, where basically one of the wires got nicked that wasn't supposed to, or you just seem to be in more of a high sympathetic state after that. So having a Holter monitor where it gives you a 24-hour average heart rate, and then see does your heart rate drop while you're sleeping when you should be under lower sympathetic stress. That would be important to see, but you'd have to talk to the EP doctor that did the nodal ablation to see if there's anything that they're concerned about. Is there swelling in the atria that may be causing some of this transient tachycardia? The next question, what further testing would I recommend for somebody with a high apolipoprotein B, or ApoB for short? So test, don't guess. You actually want to look at the arteries. Blood is interesting, but this is a snapshot in time. You really want to know what is going on with the artery health. So I frequently talk about the endothelial glycocalyx and the underlying endothelium. Those are the lining of the arteries. If those linings are damaged, then you're set up to develop plaque in the arteries. Then you can go look at functional testing for the arteries. There's tests such as the max pulse, which looks at pulse wave velocity. So how stiff are the arteries? As the blood's ejected from your heart, goes in those arteries. The arteries should expand and contract very quickly. The lower the pulse wave velocity, the healthier the artery. The stiffer the artery, the higher the pulse wave velocity. Other, quick check is just your blood pressure. Your blood pressure should be less than 120/80. If it's not, often have signs of endothelial dysfunction. Then there's a test that measures your endothelial function called the EndoPAT, which we do in our office at Apollo Cardiology here in St. Louis, which tells you how much can your arteries dilate when there's a hyperemic response. This is mostly driven when you exercise. As you push blood into your arteries when you're exercising, the arteries should be dilating because nitric oxide is getting released as the blood flows over the glycocalyx. So you want to test the endothelial function. Potentially you would look at, depending on your age, what is your carotid intimal medial thickness score? What is your arterial age? Is it higher than your biological age? Same as biological age? Do you have soft plaque in your arteries? Do you have hard plaque in your arteries? And then you can look at tests that look at, the coronary arteries. The basic test that you should consider is a CT coronary calcium score, or CAC score. That's for anybody over the age of 40 who's not previously had a heart attack, stroke, stents, or bypass. If you have a high calcium score, you have high plaque. You're going to want to address those lipoproteins then more aggressively. A more sensitive test is the clearly CT angiogram. So that actually looks for the total plaque volume in the arteries, how much hard plaque, how much soft plaque, how much potentially vulnerable plaque that you have. So treating the arteries is more important than just necessarily looking at what's floating in the blood. Question from one of our patients that comes in to see us from out of town. Right now, about 40% of our patients travel to see us. So what is somebody's question? It was, how can we keep our mitochondria healthy? So your mitochondria are the organelles in your cells that make energy for you. They have many other effects, but the mitochondria are always sensing the EMF environment that they're in. So keeping non-native EMF low, so Wi-Fi, Bluetooth, 5G low would help. But this is where light, water, magnetism, the things that Dr. Jack Kruse talks about. So optimizing your circadian rhythm, so bright light in the morning from natural sunlight, blocking artificial light at night, or particularly when you're using devices that are backlit with blue light, grounding or earthing, getting free electrons from the earth, negative charge from the earth. Seafood has high DHA. The DHA has a lot of electrons. And then potentially using photobiomodulation if you don't have access to sunlight where you're at. Sauna use, cold therapy, things that improve mitochondrial energy redox potential. That's what I would start with. Another question about the Clearly scan. Does it just tell you if somebody is high risk, or does it help you customize your approach? It does both. So Clearly scan looks for total plaque volume. So think of your artery as a garden hose. How much plaque is in the entire length of the artery? Then also, what is the plaque characteristics? Is it calcified plaque? That's basically a scar or stable plaque. Is it soft plaque? That's plaque that potentially could rupture. Or is it low density plaque? That's inflamed plaque. That plaque is much more likely to basically rupture through the thin cap of the plaque, the blood clots, and the person has a heart attack. So I can tell you what type of plaque you have in your arteries. The more plaque you have in your arteries, the higher the risk that you have a cardiovascular event. If also do you have stenosis, that's a much secondary effect of the test. How much blockage in the lumen of the artery. If you have a greater than 70% blockage in your artery, you're probably going to have some symptoms when you exercise. You'll probably be short of breath or chest pain or shortness of breath when you're doing physical activities. If not, plaques in the 30-40% range, you're probably not going to feel those. The stenosis is interesting, but not the most important feature on the Clearly scan. It's the total plaque volume and the percent atheroma volumes. So it can guide you on how aggressive to be with your lipoprotein management, how much to support things where I use it routinely in patients who are more invested in their health and really want to know how much plaque they have so they can really get ahead of any risk factors that are causing that plaque. Question, how does high LDL cause heart disease? I wouldn't say LDL itself does. It's the particles. Particles predict risk, not the LDL. So cholesterol is just the passenger inside the lipoproteins. So it's the ApoB containing lipoproteins, which are the LDL particles, the VLDL particles, the ILDL particles, and the LPA particles, if you have it, which 20% of the population has high LPLA. So it's ApoB containing particles that when the glycocalyx has been damaged, the ApoB particles stick to the lining of the artery like Velcro. They get retained in the artery wall. The white blood cells gobble up those lipoproteins, causing inflammation in the arterial wall, the intima. Ultimately, plaque will start to form. And think of it like a pimple growing in the wall of the artery. That's how the lipoproteins contribute to heart disease. Then the question, I'm not quite sure I'm the expert on this, but an interesting one. It's, how does the mammalian diving reflex benefit heart and vascular systems? So getting cold exposure activates this mammalian diving reflex, and it slows the heart rate down, and it prioritizes blood flow to the heart and brain. So this is probably somebody asking about like cold water submersion or cold thermogenesis. That's the kind of pat answer is that it's going to prioritize blood flow to the heart and brain. All right, and then there's some other questions here. All right, question about a product called Arterosil. So does Arterosil affect the blood pressure? Also, how long are the effects of N101 stay in the system? So this is a question about the endothelium and the endothelial glycocalyx. So I'll take the second one first. The N101 is a oral dissolving lozenge. It was developed by Dr. Nathan Brine, who's a world leading expert in nitric oxide research. So N101 releases nitric oxide when it dissolves in your saliva, and then when you swallow it, it helps recouple the ENOS enzyme, the endothelial nitric oxide synthase enzyme. So it helps your body produce nitric oxide more efficiently. The lozenges are generally recommended 1 twice a day. I believe after 30 days, some people will cut down to like 1 a day, but most people probably truly need 2 a day. So 12 hours or so is probably the effect of it. Then Arterosil is a glycocalyx promoting supplement. The glycocalyx is a protective gel coat lining the arteries. Think about taking a fish out of water that's slimy. That is the coating of the lining of the arteries that looks like the glycocalyx. Arterosil has building blocks for it. It's made of rhamnolic sulfate, which is a type of seaweed, Monostrium nitidum. It may help lower blood pressure, more diastolic. Now, if you have normal blood pressure, it really doesn't cause you to go low and get symptomatic, but if you have higher blood pressure, it may help lower blood pressure about on order as like a prescription medication would. So you do want to know what your blood pressure is before starting these supplements because they do have an effect on blood pressure. All right. And then this is kind of a broad question, so I don't know exactly what the question is, but it's, could any supplements such as berberine cause arrhythmia in the heart? So yes, any supplements and medications could cause arrhythmias. Now, could berberine itself? Unknown. I've not seen that clinically. Berberine is mostly used for people who are using it for glucose control. It can also work as a weak oral PCSK9 inhibitor, so it helps lower cholesterol, similar to Repatha or Praluent, if you're familiar with those injectable PCSK9 medications. May have some effect at decreasing oxidative stress on the glycocalyx, so I use it routinely in my patients. Bowel intolerance is probably the main side effect that some people notice with it, but I've personally been taking berberine for 3 years or so, and no side effects from it. But I've not personally in my practice seen anybody having any arrhythmias from it. But definitely, if you take some other supplements, there's always a risk of it. So you want to know kind of what your kind of baseline is. If you start any new supplement or medication and you have any type of symptoms, work with your doctor who recommended it. If it's safe enough, they will have you stop it, see if the symptoms go away. If symptoms go away relatively quickly, then you probably are sensitive to that supplement or medication. If the symptoms are not too severe, often you may recommend a re-challenge because it's not always clear that it's the supplement or the medication causing the side effects. Sometimes people get viruses and bacterial infections that kind of trip things up. But if the symptoms are severe, definitely don't re-challenge things with it. So those were the pre-submitted questions for Monday night. I appreciate people submitting them ahead of time. We're going to go back to the regular scheduled programming next Monday, 6 p.m. Central Time to do AMA. I do see a few people logging on here and putting in some questions, so I'll try to answer what I can. But it's always amazing that people from all over the world are joining. Somebody from Brazil's on here, and then we see somebody from Montreal. So awesome. Like I said, right now at Apollo Cardiology, we have about 60% of our patients are local to St. Louis, and 40% of people who travel in to see us. So for those people that aren't my patient yet, we still are open to new patients for the time being. But most patients, we do what's known as a 2-part deep dive. They come into St. Louis to see us. They're in an office for about 4 hours or so. We do all the non-invasive testing that I mentioned earlier in this AMA. So, we do the max pulse, the pulse wave velocity test to see how strong the arteries are, expanding and contracting. We look at blood pressure. We have a device that looks at central aortic blood pressure, basically the blood pressure that your heart and brain and kidneys all sense. We do the EndoPAT test to tell you how much nitric oxide your arteries can release when there's a stressor to your system. We do more testing that looks at blood pressure to your legs. It's called an ABI, or ankle brachial index. We have an ultrasound that looks at your aorta, make sure you don't have a dilated aorta aneurysm. So we're looking at multiple territories in your 60,000 miles of blood vessels. If you've not had a recent carotid scan, then we do a CIMT to evaluate your arterial thickness, your arterial age, and then depending on your story, we'll either send you for a calcium score test or clearly scan to tell you how much plaque you have in your coronary arteries. Then if you haven't had recent blood work, we'll send you off for either Cleveland Heart Lab testing, Boston Heart Lab testing that looks at markers of oxidative stress, inflammation, lipoproteins, hormones. And then often we do genetic testing to say, what did mom or dad give you that may increase your cardiovascular risk, and then show you how to mitigate those things through a combination of lifestyle interventions, supplements when needed for deficiencies, and medications when there's higher risk findings. So if you're interested in that, you can go to my website, it's drtwyman.com, and there's an application there. One of the members of my team will reach out to you after you set up a Zoom call with you. There's actually a link in there that says set up a Zoom call. They will then talk to you and walk you through the logistics if you want to work with us. Somebody said, why would their LDL be 180 milligrams if they're completely whole food, plant-based vegan? I don't know what SOS free is, but there are many genes that affect lipoprotein metabolism. Nearly 3,000 genes. Diet is one lever that affects lipoproteins. Often it's not even that strong of a lever unless somebody's insulin resistant or they're eating a keto diet and they have an ApoE4 allele. But often, in this case, we would do a Boston Heart Lab panel, see if you're a hyperproducer of sterols or a hyperabsorber of sterols. Look at your ApoE genotype because that gives you an idea, what's going on with your LDL receptors. And then there's a test called the GB Insight panel. It's an oral swab that looks at about 120 some odd SNPs that affect lipoproteins. And you can see, okay, what genes may be affecting it. But I really don't care what your cholesterol is. That's maybe controversial for cardiologists to say. I care what's going on with your arterial lining. What is the health of the glycocalyx and the endothelium? How much vascular inflammation you have. Then that gives you an idea of how aggressive you need to be at lowering the lipoproteins. Question up, how would you repair the glycocalyx? Great question. This is something we do every day at my practice. Is first, do no harm. So get the person out of their own way. So help them lower oxidative stress and inflammation if present, reverse insulin resistance if present, help them manage their stress, help them to get sleep better, optimize their circadian rhythms. And after you're done the kind of low-hanging fruit, then there are other things that can be done. So, things such as Arterosil, can repair the glycocalyx. Kylo garlic potentially helps. Omega-3 fatty acids, statins, berberine. There's many things that potentially help support the glycocalyx. Okay, so somebody says that their mother has a high troponin. Is the angiogram test best? Anything less invasive? Only symptoms are fatigue and low heart rate. So I can't give one-on-one medical advice without knowing the patient's full story. And also troponins are usually a test that's only done in the emergency room when patients are showing up with symptoms. Now they're showing up with chest pain, shortness of breath, fatigue. There's different assays, there's different high sensitivity assays, so I don't know what these numbers mean, where they are in the reference range, if they're truly elevated or not, how high is it on the reference range. But if the person has symptoms, then a diagnostic angiogram is often the best case to look for any plaque ruptures. Less invasive tests aren't really going to answer the question. Stress tests would not be appropriate if you have high troponins. Potentially you could do a CT coronary angiogram if the hospital has the capacity to do a CT coronary angiogram. And then, depending on the findings of the results, they'll treat it. But this is where you would do the deep dive with potentially genetic testing and advanced lipoprotein analysis to figure out why the person has high troponins. Somebody's asking about what red light panel would I recommend. The answer is it's going to depend on the use case. I've used many different devices. The panels are honestly not the best use. It's better to have direct skin contact. So battery powered devices may work better for some people depending on what you're trying to treat. But if you're interested in more of the panels that I potentially would be using in my own practice, I'd use a lot of EMR tech panels. I have their Inferno at home. I have the Firewave at home. I have the Firehawk, which is the 8-foot tall panel in my office where I can utilize it for patients to help charge up their mitochondria and teach them how to use photobiomodulation. I have a website called redlightdoc.com that has some of my prior videos where I talk about use cases of photobiomodulation, and then has some links to some of the companies where I've either had their devices or I've spoken to their owners. I've done some AMAs with them in the past, and I know that they stand by their devices. So if you go to my website, redlightdoc.com, you'll get some more information there for that. This is a question I won't know the answer to. What can be done to prevent venous insufficiency after ablation? That shouldn't necessarily be a common side effect from it, but I think things that would improve venous flow. So exercise, grounding, those would be some of the starter points. Potentially photobiomodulation to any affected veins would be something else to consider. But definitely talk to the EP doctor who's doing the ablation to figure out if they have any recommendations as well. Can exercise trigger my arrhythmia. I don't know what arrhythmia you're having, but yes, exercise definitely can trigger it as you increase sympathetic tone, but sometimes exercise actually suppresses arrhythmias. So it depends on what arrhythmia it is. And then why does the person's heart rate go up and down erratically after exercising? Unknown. Would need to do a physical exam, blood testing, potentially longer-term monitoring. So either 48 monitor, 7-day monitor, 30-day monitor, and also potentially do an exercise stress test where you can actually see the heart rate under strain and see how fast the heart rate goes up with exercise and how fast does it come down afterwards. So what is the heart rate recovery? Generally the heart rate should drop by at least 12 beats in the first minute after stopping exercise. All right. Well, I think that was the last comic question that I had seen. So I appreciate your guys' time and attention today. I'll be back next Monday, 6 p.m. Central Time, going over some other questions that you may have. I'll probably share some more things about my experience at the Canyon Ranch and my stories over the next few days, but it's an amazing place if you want to go to really kind of recharge your mind, body, and spirit. So check out the Canyon Ranch if you haven't heard of them before. So have a great rest of the afternoon, guys, and we'll see you next week.